Hi, I'm Jayne O'Donnell, health policy reporter at USA Today. I'm here today with Dr. Christine Moutier, the Chief Medical Officer at the American Foundation of Suicide Prevention. Doctor, could you explain, everything seems to be going in the wrong direction when it comes to suicide. Could you kind of sum up the trends in the different ethnic age groups, race?
Sure, yeah. Yes, so in the United States, unfortunately, the rate of suicide nationally has been on the rise since 1999. Overall, it's a total of a 33% increase, which is clearly going in the wrong direction. Now, of all people who die by suicide, 80% of them are white males. And among age groups, it's the middle-aged American group that is actually at the very highest risk of suicide these days. But for other demographic groups, the rate is also going in the wrong direction, although their rates start at a much lower rate. So for example, among African American young men, there's been a slight increase. And then among other, when we think about age groups, for young people, teens and young adults, the rate is also unfortunately going in the wrong direction. And so even while there are so many positive things happening in terms of attitudes about mental health opening up, there are things that we have yet to do, which we need to do, to try to bend that curve and that national rate of suicide.
So what needs to happen to better diagnose, to figure out who is most at risk of suicide attempts and completion, and to treat these people? What are the most important things that need to happen?
Sure. Well, outside the clinical setting, there are many things that can be done, mostly education of teachers, of parents, of peers, of coworkers in a workplace setting, so that it becomes safe to be able to tell somebody if you're struggling and if you're thinking of suicide. And then within the healthcare setting, there are many things that can be done, and there's a movement going actually in the right direction, but it's kind of step by step. Screening for not only depression but suicide risks specifically, and then getting people into the right kind of care that actually has shown evidence of saving lives. That kind of model has yet really to be scaled up among health systems.
And the best kind of care, particularly when you're dealing with talking about young people, what is the best kind of care? Is it seeing a psychiatrist every week? Is it seeing a psychologist every week? Is it medication?
Well, it's going to look different depending on what their needs are. So I would say at a minimum, it should be therapy, psychotherapy with a mental health professional. Now, many people who haven't yet had any experience getting mental health professional help might start with their pediatrician, with their primary care, and ask, what are the resources in town? If you need to use your insurance, that might be a question that you have to look into. But really, I think, again, the most important thing is that we need to become smarter about detecting behavior change. We write too much off to teenage angst and kind of just situations. We all live in stressful times, but if you notice that somebody doesn't seem themselves, that's the time to act.
What is the role, what do you see as the role the media can play, or does play, I should say, and also the television show 13 Reasons Why? Does that remain of concern as far as influencing in one direction or another?
The most important thing the media can do, and I'm talking about entertainment, but also news media as well as social media, is to normalize the struggles people face and their ability to get through it, oftentimes with the help of others. That should be something that becomes so normal to reach out for support. So when it comes to shows like 13 Reasons Why, part of it is that when so many young people are viewing a show like that, it's going to have a different impact on different individuals depending on where their mental health and where their suicide risk is at in that moment. What I'll say is that after season 1, the subsequent season of 13 Reasons Why really showed support groups, treatment of PTSD, the grieving after a suicide loss. The adults got much more involved with the young people in that storyline. So there are a mixture. There was obviously concern based on the first season, but those messages of hope and healing and resilience can be told and are being told.
What role can and should schools be playing? You mentioned there is some really interesting work being done at some schools.
There is. The schools have an incredible role to play because their teachers and staff have eyes on our kids, for more hours in the day than oftentimes parents do. And so they might detect changes in behavior. So many schools have employed something called a suicide prevention policy or plan. They train their staff. If you're connected to a school that hasn't started this yet, go to our website, afsp.org, and you can find the model school policy for suicide prevention. There's also a toolkit for after a suicide has occurred in order to allow the community to grieve, but not allow that risk of contagion to really get out of control.
Where should people go for help? What are the resources that are out there?
Sure. If you yourself are struggling, first thing to know that you are not alone, and the Suicide Prevention Lifeline is available 24/7 at 1-800-273-TALK, or if you prefer to text versus pick up the phone, you can text the word TALK to 741-741. And if you're looking for more information about suicide prevention and how to get involved, go to afsp.org.
Thank you so much for being with us today.
You're welcome.
Hey, thanks for watching. If you like this video, check out these other videos from USA Today to stay up to date with all the latest news.